we're announcing the vaccination of children between 5 and 11 years old. Scientists have made sure that the vaccine is very safe for children. They'll receive a pediatric dose specially made for them. I know some parents will worry, and it's normal to ask questions for our children. You'll find many answers on our website, quebec.ca. And I'll say it's useful to vaccinate children for 3 reasons. First, even though kids are less likely to get sick, we've seen some of them have severe symptoms and even long-term effects. Second, vaccination will help us keep our schools open. And third, children will be able to hug their grandparents safely. I invite parents to make an appointment with Clic Santé. We'll start the vaccination tomorrow, and it's important to say that no children will be vaccinated in our schools without the consent of their parents. Regarding the third dose, people over 70 can make an appointment if they received their second dose more than 6 months ago. The situation in Quebec is good. If we compare ourselves to other countries, we can be confident if we continue to follow public health rules, and it's thanks to all of you. Our nation is able to come together when necessary, so thank you.
You've mentioned that 80,000 people have already signed up. Someone at our office was trying to get an appointment for their child, and the next available date is December 7th. So did you anticipate such a huge outpouring of interest, and can the system handle it? Can Clic Santé handle this?
We sure can, but Danielle, I'll let you answer that one.
We all have short memories. I remember during spring, we were able to, Clic Santé was able to absorb more than 200,000 per day. So 80,000 for the moment, and I'm sure that number will increase probably significantly even tonight. The system can absorb everything. Our vaccination center are ready, and December 7th, it's great, because we're going to have appointments this week, next week, and the week after. So again, it's what you're saying right now. It's great. It's great news. The system is working well.
Maybe one thing that I would suggest, Danielle, that we explain to parents, and we didn't do in French, maybe we should do as well. One of the reasons that we start with appointment as opposed to without appointment is we are at the beginning of the winter, and we don't want long lineup of people with their kids waiting outside in line. So that's therefore why we recommend that people will take appointment, and that's probably the reason that we'll see a surge of appointment at the beginning. That would probably level off over the next few days. But I just want to make sure, because I've discussed that with Danielle many times, we will never refuse a family going to the center of vaccination if they don't have an appointment for the second or the other kid. Okay, we prefer appointment at this time, but we will never refuse somebody that doesn't have an appointment, because we try to avoid long lineup outside, and that's the reason we prefer this hybrid approach: vaccination center with appointment, and the school starting next week.
And if I may add, Mr. Dubé, we also have a toll-free number for, let's say, a family who doesn't have access to a computer. So we can register them through Clic Santé as well.
I also have a question about some confusion with the intervals between the shots. Health Canada is saying 2 weeks or 3 weeks. You guys are saying 8 weeks. And there's also confusion. I'm hoping maybe Dr. Rita, you could clarify this. If children are getting a flu shot at the same time, do they need to wait between the flu shot and the COVID shot? Can you clarify this confusion for us?
Yes. First of all, it's clear that Health Canada is telling what have been proposed by the companies, and it can be done with a 2 weeks interval. But I would say that our own immunization committee, the SIC, and the CCNE, the committee also from Canada, has recognized that 8 weeks is probably a better thing because of the effect on long-term immunity, and also it can prevent less side effects. It can have less side effects if you wait for 8 weeks. So the recommendation we receive from our experts in public health is 8 weeks. Now, for the situation of flu shots, it can be done most of the time. We prefer to wait 2 weeks in between the shots. But if it is received or there is a reason for giving it together, there is no big problem.